You may have been given a handout entitled Donor Site Care of the Mepilex AG. Please follow along now or view the handout at the end of the video. A donor site is an area where a very thin layer of your skin has been removed and been placed over your burn wound. The donor site is covered with a dressing called Mepilex AG. This is a foam dressing with silver inside of it that helps with the drainage and antimicrobial protection. This will be taped in place on the edges, and an ACE wrap will be placed on top of that. Remove the ACE wrap in about 2 days after your surgery. It will dry as the donor site heals. The tape will hold the foam in place. Do not cover the dressing with thick layers of clothing or blankets. There may be some drainage on your foam, like brown spots or dark areas. Sometimes up to 2/3 of the foam will have brown areas. This is all normal. Occasionally, a corner of the foam will slip off the donor site, or the foam will become totally soaked with drainage. If this happens, it needs to be changed. To change or repair a slip of the Mepilex AG, follow the simple directions on the handout. Call the burn clinic for advice. The donor site foam dressing normally needs to be removed at about 2 weeks after your surgery. You may have been instructed to remove your donor site Mepilex AG before returning to the clinic. There are 2 easy methods to remove your dressing at home: the wet method and the dry method. Assemble your supplies before starting your dressing change. Wash your hands before touching your donor site dressing. Remove the border tape from around the edges of the foam pad. Be gentle with removing the tape to not irritate your skin. Sometimes a little oil will help soften the tape. You can use household olive oil, vegetable oil, or mineral oil. If the area of your graft allows, you may simply get in the shower or the bathtub and soak the dressing off. If you're not able to shower, you can place a soaked, wet washcloth on the foam pad. You may need to replace the wet washcloth a few times. When the foam is wet with water, it will gently lift off the donor. Gently remove the foam. Wash your hands before touching your donor site dressing. Many people find the dry method easier if they cannot jump in the shower. Gently lift the edge of the pad with one hand. With the other hand, tap or slide your finger on the donor site skin and separate the pad. This folds the foam back on itself. This puts less pull or stress on your new skin. You will be surprised how gently this removes the pad. The new donor site skin will look very different for each person. Remember, what you see today is not what your donor site will look like in 6 months. You will usually not need a dressing over your new donor skin. All donor sites need to be gently washed daily with soap and water and a washcloth after the foam dressing has been removed. If your donor site has dry or scabbed appearance, apply a thicker moisturizer or ointment to the donor site for a few days to help lift off these scabs. We suggest Aquaphor or Vaseline type ointments. Some people will have a few small scattered open areas on their new donor site. These are normal and will usually heal very quickly. Apply an antibiotic ointment and a Band-Aid to these open areas. Moisturize the rest of your donor site with Aquaphor or a Vaseline type ointment. If you have a large open area on your donor site that is too large to be covered with Band-Aids, please apply greasy gauze and an antibiotic ointment. Please call the Burn Center for additional advice about these open areas. Remember to be gentle with your donor site care. Friction, bumping, or trauma can cause blisters to form. Donor sites can be fragile for up to 3 months as the skin matures. Soak off any Band-Aids you use for open areas or blisters. Moisturize your donor site at least once a day. Avoid rough clothes like blue jeans, denim, or cargo work pants unless you have a layer of clothing underneath. You may benefit from wearing soft, snug-fitting lycra, spandex, or cotton shorts, tights, or pants under your clothing. This can prevent blisters and friction to your donor site. We hope this video helps you understand how to care for your new donor site and how to remove your post-operative Mepilex AG foam dressing at the correct time.